Assalamu alaikum students. I am Dr. Asma and I am here with you to wind up the region of abdomen and pelvis. Today I am going to discuss with you the last topic of this region, that is the gross anatomy of perineal pouches. And also this is the last lecture before the summer vacations, and I hope you will utilize the summer vacations by preparing well with the region of abdomen and pelvis, because after that when you are coming to the college we are going to take the final stage of abdomen and pelvis. So this picture is showing you the boundaries of the perineum. What is perineum? That is a diamond shaped area which is located between two thighs, and this is making up the lowermost area of the abdomen and pelvic region. So here the pelvis is going to end up. So very simply, if I say please sit inside the pelvic cavity, definitely you are going to sit on the pelvic floor, which is formed by this pelvic diaphragm, that is the muscle which is Levator Ani. And if you are sitting on this Levator Ani muscle, and if I say remove this Levator Ani or pelvic diaphragm on which you are sitting, then definitely you are going to fall into the perineum. So this is making up the more superficial area present on the lower aspect of the pelvic region. That is actually the lowermost area of the trunk. Now here you can identify the boundaries, where you can easily see that there is an anterior triangle which is the urogenital triangle, and the posterior triangle is anal triangle. These are going to be divided because of that imaginary line which is between the anterior aspects of two ischial tuberosities. So when you draw a line between two ischial tuberosities, then the area which is present anterior to this line is the urogenital triangle, and the area which is posterior to this line is the anal triangle. And now you know that in the urogenital triangle, in the male there is the opening of urethra, and in female along with urethra there is the opening of vagina, which is the genital structure. And posteriorly in anal triangle is the opening of anus, which is the terminal. So again, if you view the perineum from the inferior aspect, that is the area between two thighs, and you are viewing it from more superficial aspect of the trunk here, then you can see this is the diamond shaped perineum, which is starting from more anteriorly from the inferior aspect of pubic symphysis. Then there is the inferior margin of ischiopubic rami on each side, and this is the ischial tuberosity. Then along that is the sacrotuberous ligament, which is now ending up more posteriorly to the coccyx. And the line which is joining two ischial tuberosities, that is the dividing line which is making the demarcation between an anterior triangle, that is the urogenital triangle. Here you can see this urogenital structure of the female, and the posterior triangle is the anal triangle. So if you have a sagittal section, what is a sagittal section? Which is dividing the body into right and left half. So you can see this is the dividing line for the section which is giving you a sagittal section of the pelvic wall. So here you can also identify that from the posterior most aspect, if you see this is the coccyx, and then you can move along that sacrotuberous ligament towards the ischial tuberosity. This is indicating the area of anal triangle. Then moving more anteriorly from this ischial tuberosity to the inferior aspect of pubic symphysis along that ischiopubic rami, this is indicating the area of urogenital triangle. And here this central point which you can see here, this one, that is the central point of the perineum, which is along the dividing line between two ischial tuberosity in the midline. This is making up the perineal body, where many perineal muscles are going to attach. So this is the perineal body, and that is very important clinically, as I hope now that in your previous lecture you already have done its clinic. Now see here some important structure which are present along that urogenital triangle. This is this triangular membrane which is covering and present along the anterior most urogenital triangle. This is perineal membrane. The perineal membrane is present only on that anterior urogenital region, and it is not present along the posterior anal region, which is the anal triangle. Here you can see very easily. So keep in mind that this perineal membrane is only overlies the anterior most aspect in the perineum, which is along its urogenital triangle. It is having the aperture for the passage of the urethra and vagina in the female, and only urethra in the male. And if you look at here its most anterior margin, that is here, it is going to have this deficient area, which is the area between the most anterior margin of the perineal membrane and inferior pubic ligament. So this area is for the passage of some vessels and nerves, which I will show you in the next slide. But keep in mind here that more anteriorly this perineal membrane has this opening. Now look at this posterior anal region. Here you can see that this membrane is deficient and it is not present over here. So keep in mind, for the structure passing or piercing through the perineal membrane, you must not write the anal canal is passing through it, because at this region the perineal membrane is not present, and mostly the students in flow along with the urethra, vagina, they also write that anal canal is passing through the perineal membrane. So please remember this picture. Keep it in your mind that more posteriorly this membrane is not present, so anal canal is not at all passing through the perineal membrane. So what is this muscle? You can see here that is the levator ani muscle forming the pelvic floor or the pelvic diaphragm. If I remove this muscle from here, then you can also see and appreciate in this picture that posterior aspect has no such membrane, and this perineal membrane is only overlying the anterior urogenital region. So this is covering that triangular urogenital region only at here, and this is the line which is showing its attachment as well on each side, and along that interischial transverse line you can see its posterior margin of the perineal membrane. And this here in the center, this perineal membrane, it is going to attach and blend with the perineal body, as well as it is going to continues with the Coulé's fascia, which is more superficial fascia present superficially just beneath the skin of the perineum. So if I cut that block of the perineal membrane and you are going to view it from this superior aspect, or you can say you are looking on this block of the perineal membrane from above, then you can also appreciate these muscles are present, and the perineal membrane is present along and it is present below these muscles which are I can see here in this slide that in this picture, this whole blue area that is showing you that it is the margin of perineal membrane, and above that perineal membrane there is these very important muscles you can see. Number one is this transverse perineal muscle. This is present above and deep to perineal membrane, so we label it is the deep transverse perineal muscle. As well as it is having the sphincter urethrae muscle, which is going to encircle the urethra, and as well as it is going to make this one, which is the sphincter vaginalis, and then this compressor urethrae. So these sphincter urethrae muscle, in the old concept, these two, the sphincter urethrae and this deep transverse perineal muscle, along with that perineal membrane, is making up the urogenital diaphragm. But now the concept of urogenital diaphragm is obsolete, and it is studied now, and it is noted that the sphincter urethrae muscle is actually the muscle which is present along the walls of the urethra. So these are present in the urethra and making up its wall. It is not a separate muscle. So only this deep transverse perineal muscle is present, and this sphincter urethrae is making up the external urethral sphincter, which is the part of its wall. And here in the male you can also see this is the sphincter urethrae component, and this muscle is encircling the urethra, and that muscle is the deep transverse perineal muscle. So this is very important to note it down, that these structures, these are present deep to the or above the perineal membrane. So what is the location of this block to fit into the pelvic cavity, into the perineum? Here you can see this is again one sagittal section in which you are going to see the one half of the pelvic cavity, and this is showing you the pelvic diaphragm, that is Levator Ani muscle. So you can see this is a sacrum, and this area is the coccyx. So this is most posterior aspect where you can see this aperture, which is for the anal canal. So anal canal is passing through that Levator Ani along with its muscular sling, and then this is the that part of the perineal membrane along with its deep muscles. This is going to lie over here just beneath the Levator Ani muscles into the perineum. So you can simply say that perineum is the area which is now present beyond the or beneath the Levator Ani and pelvic diaphragm. So when you remove it, you are going to enter into the perineum from above, from pelvic cavity. So this area is showing you now that this is the perineal membrane, which is only covering and present along the anterior aspect, which is the this anterior aspect of perineum is the urogenital region and urogenital triangle. So now this perineal membrane is not alone. On above you can see there is a deep transverse perineal muscle, and as well as this urethra having that muscle which is the sphincter urethrae making up its external urethral sphincter. So here you can see this one is the area of the perineal membrane. This is the perineal membrane. So if you cut that perineal membrane, what you will see? There will be the deep structure to that perineal membrane is the deep transverse perineal muscle which is present over it. So the area now which is visible to you, which you can see and follow now, is the area that is making up the superficial perineal pouch. So these are the pouches, the superficial and deep pouches, because these are present above and below the perineal membrane. So these are overlying only the urogenital area. These are not lie along that anal area, because here what you have seen there along that area you have the ischiorectal or ischioanal fossa. That is the space which you have studied before previously in your lecture. But here along the anterior side, anterior aspect along that urogenital triangle, you are going to have the superficial and deep perineal pouches. Now in between the thigh, now you are looking into the perineum. That is the perineum of the female, and that is the area which is showing you the superficial perineal pouch. And if I remove that perineal membrane, then you can see the area of deep perineal pouch, which has the deep transverse perineal muscle. And here you can see in the superficial pouch is this superficial transverse perineal muscle. So this is making up, that perineal membrane is making up the deep boundary of that superficial pouch. What is present superficial to that, which is making up the superficial boundary. Here you can appreciate this membrane like structure, which is the Coulis fascia. You have already studied that Coulis fascia, that is the extension of the fascia here in the pelvis and the perineum. I request you to gather up the knowledge from your previous slide and make a good concept of the boundaries of superficial perineal pouch. So if you look into the perineum from the superficial aspect, then definitely there is the skin, and then if you approach from the skin, there is the superficial fascia, which is here in the perineum, known as Coulis fascia. That is the extension of the membranous layer of the superficial fascia into the perineum. So first of all, from more superficial aspect, you encounter the Coulis fascia, that is making the more inferior boundary in the superficial perineal pouch. Then in the deep boundary, which is making its superior most boundary, that is the perineal membrane. So definitely it has to be present in its deep boundary, because I have already told you that the superficial perineal pouch lies below the perineal membrane. So that is going to make its superior boundary. On each side, laterally, the pouch is bounded by ischiopubic rami, and posteriorly it is closed by the fusion of its superior and inferior boundary, which is the fusion of perineal membrane with the Coulis fascia posteriorly. And I hope till now you understand it very well, because in perineal membrane you have already discussed that this is going to blend posteriorly with the Coulis fascia and perineal body. Anteriorly, the superficial perineal pouch is having an open communication, that is continuous and communicates freely with the potential spaces present between the superficial fascia of the anterior abdominal wall and anterior abdominal muscles. So in the male, if you see, then this superficial perineal pouch is going to continuous with the space around the scrotum, the space of the penis, and then continues into the anterior abdominal wall. In the females, the superficial perineal pouch is continuous along the space of the clitoris and then communicates with the anterior abdominal wall. So make very clear concept of the perineal membrane and the Coulis fascia. This whole green color here is showing you the deep fascia in the pelvis and in the perineum. So the perineal membrane is actually the deep fascia which is present in the perineum, and this blue one is showing the superficial fascia in the pelvis in this external genitalia, and then it is here also in the abdomen. So actually the spaces which we are going to study today, the superficial and deep perineal pouches, are the spaces which are because of the arrangement of the superficial fascia and deep fascia of the perineum in the urogenital triangle. So in this region, you can see here, this is the perineal membrane that is lie over the urogenital region in the perineum, and it is going to fuse and attach posteriorly with the perineal body and with the Colles fascia. So its posterior wall is going to be closed. Here this is going the Colles fascia, which is making up here the inferior or the superficial layer of this superficial perineal pouch, which is the pouch present below the perineal membrane, and the pouch which is present above the perineal membrane is the deep perineal pouch. Having this deep transverse perineal muscle, you can see very clearly. So this superficial pouch having the Colles fascia in its superficial and inferior boundary, then this is going to continues into the scrotum. So the superficial perineal pouch is communicating anteriorly with the space of the scrotum, then with the space of the penis, and then it is having the continuation and communication with the anterior abdominal wall through this fascia. Again here you can very clearly see this area is showing you the superficial perineal pouch. This superficial perineal pouch or superficial perineal space is present below the perineal membrane, which here you can see this white membrane like structure, that is the perineal membrane. So below this perineal membrane is the superficial pouch, and above this membrane lies the deep perineal pouch or deep perineal space. So you can also appreciate the boundaries very clearly, that this perineal membrane is making up the superior or the deep boundary of this superficial perineal pouch, and this is present inferiorly or superficial in the deep perineal pouch, you must remember. So posteriorly, perineal membrane is fusing with the perineal body and the Colles fascia, which is making up the inferior or superficial boundary of superficial perineal pouch. So this Colles fascia, if you follow, that is going to fuse with the perineal membrane here posteriorly. So superficial perineal pouch is closed posteriorly because of the fusion of its superior deep wall having perineal membrane with the inferior superficial boundary which is having this Colles fascia. You can see here that is closed because of its fusion here. If you follow the Colles fascia along here, which is lying in its inferior wall of the superficial perineal pouch, it extends into the scrotum, and here it is going to replace with the Dr.Asma muscle actually, but from here this pouch that is clearly you can see is going to communicate with the space of the scrotum. So we say that the superficial perineal pouch is communicating anteriorly with the space of the scrotum. It is continuous and communicate with the space of the penis, which is along that superficial fascia, and then it is continuous and communicate above with the anterior abdominal wall between the superficial fascia and the fascia covering the muscles of anterior abdominal wall. So this is the line of communication, you can see very easily. So if you focus on that space here, that is the superficial perineal space, you can see very easily that this is having here the bulb of the penis as its content, along with the corpora and crura of the penis plus its corresponding muscles. These are the corpus spongiosum having the bulbospongiosum muscle, and corpus cavernosum are having associated ischiocavernosus muscle, which are going to form the contents, the muscular contents in the superficial perineal pouch. Also you can see the urethra, which is going through this pouch. Membranous urethra here that is present, and that is continues through that deep pouch. And then this is the bulbar or the spongy urethra, which is present in the you can see very easily here in the frontal section, which is the section dividing the body into anterior and posterior halves. Also it is the coronal section. So here you once again you can appreciate that when you can see from below, this is the skin, and then this is the fascia, which is extending down here as a Cullis fascia, making up here its superficial or the inferior boundary of the superficial perineal pouch, and this is the perineal membrane, which is making its deep or superior boundary. So here you can see as a content into that superficial perineal pouch, which is between these two fascias, then you can see here this is the corpus spongiosum, along with that its muscle, which is bulbospongiosus. And on each side you can see this is again another erectile body, which is corpus cavernosum, and this is the having this muscle, which is the ischiocavernosus. So these two corporas and then these muscles are making up the content in the superficial perineal pouch in the male, you must remember. In the female, again you can see the orientation of that fascia, that this is the perineal membrane here. This is going to blend posteriorly with the perineal body and then continues through that Cullis fascia into the anterior abdominal wall. Through that fascial aspect, this is continues into the anterior abdominal wall, and here there you can see in the contents of that superficial perineal pouch you are going to have the urethra as well as the vagina. These structures are passing through it. And now what are the other structures here? Again you can see this is the Cullis fascia, and this is making up the perineal membrane here, and in between these two in the females here you can see this is the superficial perineal pouch. Now what are the contents here? You can see very easily again. Now these are making up the bulbospongiosus muscle, that is the muscle which is covering the bulb of the vestibule, and there is the ischiocavernosus, which is the muscle that is covering the erectile tissue, that is the clitoris. So this is covering along the corpora cavernosum of the clitoris. So this is having this ischiocavernosus covering that corpus cavernosum of the clitoris on each side, and this is the muscle which is the bulbospongiosus muscle that is covering the bulb of the vestibule. And along with that here these two rounded structures which you can see, these are the greater vestibular glands which are present here in the along this vestibule in the female. This is the greater vestibular glands and its ducts which are opening up into the mucosa of vagina. So these are here, that are the greater vestibular glands which are also making up the content in the superficial perineal pouch of the female. With the help of these pictures, you can very easily understand and compile the contents of superficial perineal pouches in the female and in the males. So the superficial perineal pouch in the female you can see very easily here, and you can understand that this is going to have the bulb of the vestibule along with its muscle, that is the bulbospongiosum. Then there is the root of the clitoris, and covering its erectile body, which is the corpus cavernosum, that has this ischiocavernosus muscle. Now there is this transversely running muscle, which is the superficial transverse perineal muscle. So side by side, if you look into the muscular contents in the male, here you can see this is the bulbospongiosum muscle, which is surrounding the bulb of the penis and its corpora, that is the corpus spongiosum. And on each side there is the ischiocavernosus muscle, which is surrounding the corpus cavernosum of the penis. Again here there is that superficial transverse perineal muscle, which is present here running transversely, and these are the muscular contents in the superficial perineal pouch of the male. So if you see the nerves and vessels which are present here as a content, these are the branches which are passing through the pudendal canal, that is the branches from the pudendal nerve and the internal pudendal vessels. So first of all, these vessels are entering into the deep pouch, and then by piercing the this perineal membrane, they reach to the superficial perineal pouch. You can also see here that the perineal branches of the internal pudendal artery and this nerve first of all enters into the deep pouch and then pierce the perineal membrane and then enters into the superficial perineal pouch. So first of all, the nerve, which is the perineal branch of the pudendal nerve, this is going to give three sets of the branches, which are the posterior labial nerve, the nerve to the bulb of the vestibule, and the muscular branches which are supplying these muscles. In the males, this labial nerve is replaced into the scrotal nerve. So the perineal branch of pudendal nerve in the male is giving here this posterior scrotal nerve reaching into the scrotum, and this is giving the nerve to the bulb of the penis and the muscular branches which are going to supply the muscles present here in the superficial perineal pouch. Now if you see that branches from internal pudendal vessels, these are going to give the branches which are entering into the superficial perineal pouch. These are the posterior scrotal artery and the transverse perineal artery, which are the branches from the perineal artery. Then there are other branches which are present here is the artery of the penis, artery to the bulb of the penis, the urethral artery, and the deep and dorsal artery of the penis. So same, if you see them into the female, the internal pudendal vessel that is supplying and entering into the superficial perineal pouch and giving the branches from its perineal artery, this is giving the posterior labial artery and the transverse perineal artery. And the artery of the clitoris is again giving the four branches, same as the artery of penis here in the male has given the four branches. Now In the female, these branches from the artery to the clitoris are the urethral artery, the artery to the bulb of the vestibule, the deep and dorsal arteries of the clitoris. All these structures are the contents of the superficial perineal pouch in the male and female, as we already have discussed. So now moving on to the deep perineal pouch. Now I hope you understand very well that what is the location of deep perineal pouch, and it is present above the perineal membrane. So this perineal membrane is making up its inferior or superficial boundary in the deep perineal pouch. And superiorly or above, which is the deep wall in the deep perineal pouch, it is deficient and it is open above. There is no certain landmark which is present on the more deeper part in the deep perineal pouch. Laterally again it is bounded by the ischiopubic rami, and anteriorly there is a gap between the perineal membrane and inferior pubic ligament, which I already have shown you, that aperture or opening which is present in between these two. So now see here the area which is the most anterior area, where there is a gap present in between the anterior most margin of perineal membrane and the inferior pubic ligament. So this is transmitting certain arteries and veins as well as the nerves through that gap. These are the dorsal nerve of the penis, the dorsal artery of the penis, and deep and dorsal vein of the penis. In the females, these same structures will be the dorsal nerve of clitoris, the dorsal artery of clitoris, and deep and dorsal vein of the clitoris. These are the structures which are emerging out through that aperture, which is the gap present on most anterior part of the. So this is the coronal or the frontal section of a male perineum, which is showing you the area here, that is the Coulé's fascia, the superficial most externally superficial fascia present here just beneath the skin, that is Coulé's fascia, and here this is the perineal membrane, and the area which is between this Coulé's fascia and perineal membrane is this space which is the superficial perineal pouch. And the area which is present above the perineal membrane, whole this area is showing you the location of deep perineal pouch or deep perineal space. So actually what are these spaces or pouches? These are just because of the arrangement of the superficial fascia and deep fascia of the perineum in the urogenital region, which is resulting in the formation of these two triangular spaces, the superficial perineal and deep perineal spaces or pouches. So if you look into that deep perineal pouch, you can see here the contents which are overlying in this pouch. Number one, very easily you can see that this is the urethra which is passing through that deep pouch. This is the membranous part of the urethra. So the membranous urethra is passing and traversing that deep perineal pouch. Along with that, there are the muscles which are the deep transverse perineal muscle and the sphincter urethrae, which is actually present along the wall of the urethra. Then you can see these black structures. These are the bulbourethral glands. So you must remember that the bulbourethral glands in the male, they are present in the deep pouch, and their ducts are going to open up into the urethra by passing through the superficial pouch. So ducts of bulbourethral glands are in the superficial pouch, and gland itself is present in the deep perineal pouch. Now the blood vessels and nerves, these are the one which are going to pass and enter through into the penis. So these are the dorsal nerve of the penis that is present here, and some muscular branches which are going to supply the muscles over here. Then the blood vessels which are present are the artery of the penis, and there are those 4 branches which are going to enter up into the perineum and scrotum. These are the artery of the bulb of the penis. You can see they are going to enter through it, and the deep artery or dorsal artery of the penis, and urethral arteries. So these are the structures which are making up the content in the deep. I request you to gather up the knowledge from your previous slide and make a good concept of the boundaries of superficial perineal pouch. So if you look into the perineum from the superficial aspect, then definitely there is the skin, and then if you approach from the skin, there is the superficial fascia which is here in the perineum, known as Colles fascia. That is the extension of the membranous layer of the superficial fascia into the perineum. So first of all, from more superficial aspect, you encounter the Colles fascia that is making the more inferior boundary in the superficial perineal pouch. Then in the deep boundary, which is making its superior most boundary, that is the perineal membrane. So definitely it has to be present in its deep boundary, because I have already told you that the superficial perineal pouch lies below the perineal membrane. So that is going to make its superior boundary. On each side, laterally, the pouch is bounded by ischiopubic rami, and posteriorly it is closed by the fusion of its superior and inferior boundary, which is the fusion of perineal membrane with the Colles fascia posteriorly. So again here I am showing you along with the contents, that is the deep perineal pouch in the male, which you are going to view from above. And if you look from above, then you can see there is this sheet of the muscle, that is the deep transverse perineal muscle, that is present here along the posterior margin of the the perineal membrane. It is overlying above and deep to the perineal membrane. And then is the sphincter urethri muscle, which is, as I have told you, that this is the old concept where the urogenital diaphragm is going to formed, and now it is obsolete, because now it is considered that the sphincter urethri muscle is not making up a complete sheet. As you can see here, this is actually making up and present in the wall of the urethra. So this muscle is present and lies within the wall of the urethra. So this is not making up a complete sheet as in the urogenital diaphragm considered before in its old concept. So you must remember, if anybody asks you, you would know that the urogenital diaphragm has the sphincter urethri and deep transverse perineal muscle, along with there is the inferiorly it has the perineal membrane, but actually now this is obsolete. So membranous urethra is passing, there is these bulbourethral glands, you can see the internal pudendal arteries, branches of this artery which are going to enter up from passing to the deep pouch to enter up here in this anterior gap. These are the dorsal and deep artery of penis, and there is the nerve which is the nerve to the penis. So in the female, you can also see along with its contents that if you are going to remove that perineal membrane, and that is making up its superficial or inferior wall, because you can see here this is the area of vestibule along with that gland which is greater vestibular, or it is also known as Bartholin's gland. This is present in the superficial pouch, and when you remove that perineal membrane, then you can see here having this deep transverse perineal muscle, as well as it is having the sphincter urethrae muscle. Along with it, it is having its compressor urethrae and the sphincter uretrovaginalis component in the female. And here again you can see the passage of urethra, the vagina, along with all these components, same as in the male, but these arteries and nerve of the penis as in male are replaced by artery and nerve of clitoris in the females. So these are showing you the muscular contents in the deep and superficial perineal pouch. So in this superficial perineal pouch in the males, you can revise very easily. This is the superficial transverse perineal muscle, same in the male and female, and this superficial transverse perineal muscle is present along that interischial line, and you can say it's inferior, it is lying along the inferior margin of the perineal membrane. So this is present, that interischial line, which is the posterior most line of the perineal membrane. So that is again this interischial line is dividing the urogenital region anteriorly and anal triangle posteriorly. So along with that superficial transverse perineal muscle, there is the bulbospongiosus along with its corpora, and then is the ischiocavernosus along with the corpora cavernosa on each side. In the female, along the bulb of the vestibule is the bulbospongiosus muscle and ischiocavernosus muscle, which is attached to the root of the clitoris, and these are present in the superficial perineal pouch. Now if you remove that perineal membrane, then in the deep perineal pouch in the male, there is this deep transverse perineal muscle and this sphincter urethrae, which is making up here that external urethral sphincter, and the one its components moving towards the ischial spine is the compressor urethrae muscle. So sphincter urethrae, compressor urethrae, then this uretrovaginal muscle making up the sphincter along with that vagina as well, plus again the deep transverse perineal muscle. These are the muscle present in the deep perineal pouch. So this picture is simply showing you the muscular contents in the superficial pouch and in the deep perineal pouch. So here this picture is summarizing you for the blood vessels and nerves which are going to be present and entering from the superficial perineal pouch and in the deep perineal pouch. So you can see that these nerves and arteries are coming from that pudendal canal, and then they are going to move along and enter into the urogenital region and giving here their respective branches, which are making up the content of superficial and deep perineal pouches in the male and female. So this picture will be very helpful for you to understand and memorize the arteries and nerves present in superficial and deep perineal pouches of the male and female. Now to boost up in you the concept of the perineal pouches, just have a look on this picture, and if we start it from below here, which is now the superficial most aspect, and then after removing the Colles fascia, you can see that these are the muscles and the structures which are present in the superficial perineal pouches. And now when removing all of this structure and moving deeply into the perineum, then there is this perineal membrane, and beneath or deep to the or superior to the perineal membrane, you can see that is the area of the deep perineal pouch having the deep transverse perineal muscle and sphincter urethrae. And in the old concept, when the urogenital diaphragm is present, you can have the superficial layer of the fascia of urogenital diaphragm. So these three parts, the inferiorly perineal membrane, then these muscles, sphincter urethrae and deep transverse urethrae muscle, and superior layer and the fascia of urogenital diaphragm is making up the urogenital diaphragm. But now as this is obsolete, now this superior wall is open and deficient. It is having just delicate and very weak this layer of the fascia, so that is now not considered this area as urogenital diaphragm as well, because the sphincter urethrae, that is not making up the complete sheet-like structure as you can see in this pelvic diaphragm, which is going to formed by the levator ani. So here the sphincter urethrae is considered now to lie within the wall of the urethra to form that external urethral sphincter. That's why the concept of urogenital diaphragm is obsolete. So please remember and keep in mind. And now if you remove and move above, then definitely you are going to see that levator ani and pelvic diaphragm, which is the lowermost boundary and wall in the pelvis in male and female as well. So from superficial to deep, you can see these components. Now you just have a try to move from deep to superficial and now remove all these structures, then you can come out of the perineum. So let's try that. So this is again to reinforce you that after removing the Colles fascia just beneath the skin, you are going to have these structures which are making up the superficial perineal pouch in female and in the male. So again, these pouches are the triangular spaces which are because of the arrangement of the superficial and deep fascias in the perineum in this urogenital region, and here the deep membrane and fascia is perineal membrane. And this is showing you now the concept of and the location of the deep perineal pouches and spaces in the female. By removing that perineal membrane, you can move into the deep perineal pouch, and this is showing you the deep perineal pouch of the male. So the students, here we end up with whole of the gross anatomy of abdomen and pelvis. So that's a good news for you that we have completed our first gross anatomy region in second year MBBS. And I would appreciate if you utilize your summer vacation by preparing the gross anatomy of abdomen and pelvis very well. It is very important region. You are going to have 3 questions in university from this region. Thank you very much.